There are 5 confirmed cases of the virus in Smith County. While the risk remains low, people who live here should still practice safety measures. And now, Dr. Charles Gordon of Precision Spine Care joins us live via Skype to tell us what challenges we can expect in the next coming weeks. So, Doctor, thank you for being with us. And first of all, what are you telling your patients to do right now?
Hey, Neil, good afternoon. Well, we're taking our cues from the CDC and from government guidelines, which is basically to minimize unnecessary gatherings, travel that's discretionary. We think it's fine for people to continue to come see the doctor, come to the hospital, but certainly if a person has symptoms, or particularly our patients who are more elderly and frail, we're encouraging them to reach out by phone rather than come in person.
Do you think the local officials and national officials have gone far enough?
Well, it's obviously evolving, Neil. We've learned a lot about this over the last few weeks. I think that when we go back and look at this, we'll see that these early measures to try to decrease social impact, social interaction are going to be helpful. I wish we'd been able to do it a little faster, but I certainly applaud the efforts that have been put forth so far.
Not to put you on the spot, but what about groups of people? Because this afternoon the president was talking about 10 people. Some folks are saying 50. What do you say about that?
Well, again, all we know is that the more people a person contacts, the more likely they are to contract the virus. And from what I understand and talking to colleagues outside of the country, it is a highly contagious disease. And so I think it is prudent for us to minimize our social interactions, and I'd say, 10 people or less is a good start.
Now, how important is testing not only of people with symptoms, but also people who just could be very worried?
Well, certainly I support testing as much as available. I believe what the challenge is that the tests right now are a bit limited, so we don't have access to all the tests that we need. So the guidelines are that people who are at risk or who have symptoms should be tested first. Hopefully, as more tests become available, people can be tested really at will. I would certainly support widespread testing and do that as quickly as possible.
Last question here, about 30 seconds. What's the biggest challenge we face right now?
Well, it's balancing. I don't think that people need to panic. I believe that we'll get through this. I don't think that this is the end of the world or the Black Plague by any means. But on the other hand, I do believe that it's important that we are careful and that we are cautious and not overdo it at this point in time. So I would say we need to strike a balance, and that we don't need to be terrified, but at the same time we need to be cautious.
Doctor, thank you, and please come back again, okay?
Thank you so much. Have a good day.
All right.